Welcome to today's America Walks webinar, Quick Builds in Indian Country, Advancing Road Safety Through Community Engagement. My name's Ian Thomas, Technical Assistance Lead with America Walks, and I'm joined by my colleague, Madeline McAuliffe, Communications Manager. Our panelists today will be Hillary Mead, Primary Prevention Program Supervisor with Cherokee Nation Public Health, Sherry Bozick, Director of Planning, Development and Transportation with the Pueblo of Jemez, Samantha Morigeau, Doctor of Physical Therapy with the Confederated Salish and Kootenai Tribes, Tribal Health Department, and Maya Pedersen, Assistant Professor with the School of Public and Community Health Sciences at the University of Montana. And we're delighted to welcome a special guest speaker. Julia Kite-Laidlaw is a Senior Program Manager with the Road to Zero Coalition, an initiative of the National Safety Council. As always, we're very grateful to our sponsors. In addition to the National Safety Council, these are the U.S. Centers for Disease Control and Prevention and their Active People, Healthy Nation campaign, the Robert Wood Johnson Foundation, the DeVue Good Foundation, Tool Design, and General Motors. And you can support our webinars and other programs if you wish. Here's a QR code that links to our donations page, and there's also a clickable link in the chat. If you have a question for any of the panelists, please enter it into the Q&A section. This is also where you can find the closed captioning feature. So these are today's webinar objectives. After attending this webinar, participants will be able to discuss why tribal communities experience disproportionately high rates of pedestrian fatalities, to describe how temporary quick-build projects can be used to reduce traffic speeds and improve safety in the short and long term, to plan, design, and implement your own quick-build traffic calming demonstration projects and community engagement activity, and to conduct quantitative and qualitative evaluations to explore the value and effectiveness of this strategy. Pedestrian fatalities have been rising in the United States for more than a decade. It's now up to about 7,500 pedestrians every year. That's about 20 people every day who lose their lives on America's roadways. And this is according to Smart Growth America's Dangerous by Design report. And it's really important to recognize that these traumatic tragedies, like so many other social harms, have a disproportionate impact on communities of color. African Americans are more than twice as likely as white people to be killed by a motor vehicle while walking, and Native Americans are more than 4 times as likely. Vehicle speed is the most important factor in determining whether or not a collision with a pedestrian is going to be fatal. According to the AAA Foundation for Traffic Safety, the chance that a pedestrian hit by a car at 20 miles an hour will be killed is less than 10%. This rises to about 20% at 30 miles an hour, 50% at 40 miles an hour, and 90% at 60 miles an hour. Clearly, if we want to minimize fatalities, we need to keep speeds below 30 miles an hour, preferably below 20 miles an hour in areas where people are walking. Unfortunately, that's not the case in most tribal reservations in rural parts of the country, where vehicles travel at high speeds and there are usually no sidewalks. Nor is it true in the urban and suburban neighborhoods of many cities where Native people live and have to contend with excessively wide roads and no pedestrian crossings. The problem is that these roads have been designed to encourage high vehicle speeds. However, the same roads can actually be redesigned to ensure much lower speeds by narrowing the driving lanes, reducing the long sight lines, and adding visual friction. And with thanks to Dan Burden for this graphic, I'm going to just replay that transition from a high-speed car-oriented street to a low-speed multimodal street. And while a traffic calming reconstruction project might cost millions, take years to complete, and have to overcome opposition from people who are opposed to slowing down the traffic, all of these challenges can be addressed with a temporary quick build project. Using inexpensive components, a new roadway design can be tried out for a few days or a few months and evaluated with speed studies and community surveys. Invariably, everyone recognizes the benefit of narrower lanes, more visible crosswalks, landscaping elements, and public opinion and political will can become aligned and focused on finding a permanent solution. That's the goal of our project titled Pedestrian Fatalities in Indian Country, Responding to a Crisis. For the last 15 months, Pueblo of Jemez, Cherokee Nation, Confederated Salish and Kootenai tribes, University of Montana, MG Tech Writing, and America Walks have been engaging tribal communities and implementing quick builds through a Road to Zero traffic safety grant from the National Safety Council. Oops. And it's now my pleasure to introduce Julia Kite-Laidlaw, Senior Program Manager with the Road to Zero Coalition, to make a few opening remarks.
Thank you, Ian. Let me just share my screen. Great. Thank you, and good afternoon, everybody, and thank you for joining us. So the Road to Zero is an initiative of the National Safety Council, a congressionally chartered nonprofit that aims to eliminate preventable deaths and injuries in traffic in the United States. Road to Zero was established in 2016 in recognition that roadway deaths in the US are unacceptably high, but they are preventable, and we need new strategies to address this ongoing crisis. In addition to writing reports and policy statements, hosting webinars, and collaborating to share best practices in roadway safety, one of our main activities at Road to Zero is our Community Traffic Safety Grant Program. This is funded by our partnership with the National Highway Traffic Safety Administration, part of the United States Department of Transportation. And we were proud to award a 2024 Road to Zero grant to America Walks, Pueblo of Jemez, Confederated Salish and Kootenai tribes, the Cherokee Nation, and University of Montana. And what we loved about their proposal was that this project was community-led and it embraced best practices at this hyper-local level. Because after all, who knows road hazards better than the people who have to encounter them every day? And furthermore, who therefore would be invested in making sure that whatever solutions were chosen were contextually appropriate and meant for the people they serve. This project took a proactive approach and was responsive to real needs. And this project also addressed an unfortunate and unacceptable reality in the United States, as Ian said, that who you are and where you live is a determinant of your risk as a pedestrian. American Indians and Alaska Natives have a pedestrian death rate several times higher than the national average, and the members of this project team saw that disparity and went out to address it through what's called a safe system approach. Now, what exactly is the safe system approach? Well, it's what Road to Zero is built around. It is a way of conceptualizing traffic safety that recognizes you just can't tell people what to do and hope they do it. If it was that easy, I think it would have been done by now. You need to integrate multiple initiatives to address what data shows you as a problem, and you have to rely on some key assumptions. So those are the things that are written around the perimeter of the diagram here, that the only acceptable number of deaths and injuries is zero, that humans make mistakes, we're fallible, but we need to make sure that those mistakes don't have fatal consequences, that humans are vulnerable, our bodies can only take so much force. Responsibility for the design and the use of roadways is shared with input coming from all different groups of road users. The safety has to be proactive, and there need to be many layers of redundancy to ensure that whatever crashes happen aren't serious. And at the heart of the disparity in pedestrian deaths is the fact that so many of our roads are simply not safe. They weren't built with pedestrians in mind. They were built to move motor vehicles through quickly and conveniently, and the pedestrian is always going to lose when up against that. In rural areas, on reservations, the infrastructure to protect pedestrians often just isn't there. Long, wide roads without traffic controls make it harder to enforce a safe speed. Distance from hospitals can slow down post-crash care. So you see here how we have problems compounding each other to lead to more road deaths, uh, aspects of all the different wedges of the safe system approach. And that's unacceptable, of course. But we run into realities like it's expensive to fully redesign roads. It typically takes a lot of time. But our project team found a different way to make roads more pedestrian friendly and encourage safer vehicular speeds. And that's the quick build that they'll be talking about today. And I hope that everyone watching today can learn from their efforts and spread the strategy to proactively address roadways in your community to be more at the human scale. When it comes to what's going to solve the crisis of pedestrian deaths on American streets, it's not just one thing. There's no magic bullet. It's going to be all these things working together. And the more that we can get communities involved and more that we can get local people invested in what's happening on their roads, the better. So the next round of grant funding will open for applications in late October. I encourage everyone to visit nsc.org/road to zero for more information. The application will be there in October. But today the honor belongs to this project team, and now I will hand the floor back to Ian to have him introduce the first panelist.
Thank you so much, Julia. And we're now going to present highlights of our 15-month project addressing pedestrian fatalities in tribal communities. And I'd like to introduce Hillary Mead with Cherokee Nation Public Health to get us started.
Thank you, Ian and Julia. My name is Hillary Mead. I am with Cherokee Nation Public Health, and I want to introduce our project that we did in our small rural area within the Cherokee Nation, and that was in Kenwood, Oklahoma. I work primarily with Safe Routes to School projects, and so this project came about and wanted to connect the Kenwood School to the Woody Hare Community Center. And so just a little bit about Kenwood. It's located in Delaware County in Oklahoma. It's about 20 miles southwest of Jay and about 11 miles east of Salina. The population is about 904 people with a median household income about 65,714. We do have a 16% poverty rate, and over half the population is Native American. So part of our project is that we were going to start with identifying some road hazards. We started in about August of 24. And some of our first steps were identifying what infrastructure was available, what pedestrian paths, if any, were available, looking at the line of sight. This piece that we were trying to connect is located on a pretty sharp curve, and so it's very hard to see. So we wanted to make sure that where we put in a crossing that we would be spotted, pedestrians would be spotted by both the vehicles that were oncoming, and the pedestrians would be able to see both ways. And then we also looked at our traffic conditions. And this is a very busy road. You're looking directly from the school to the community center in this picture here. And so we wanted to make sure what those conditions look like and how vehicles reacted to pedestrians in the roadway. So we started with some preliminary assessments and did a walk audit. We also did some speed checks. We're very lucky that we have a Department of Transportation within Cherokee Nation. So they were able to do some traffic counts for us. And then we also did some walk and talks and community surveys with our community members. And here's our data that we came up with. And this, like I said, was based on our walkability results, our community surveys, and our traffic counts. And just some key points from this slide is that the speed limit is 35 miles an hour on the main road. And we had between 300 to 900 cars that were traveling on this road per day. And this is during school. So we got that from a Monday through Friday traffic count. And that was, the traffic counts ran 24 hours. And so the average speeds ranged from 33 miles an hour to 40, or I'm sorry, 69 miles an hour being that top speed. And again, this is right through the community center, right through where all our school traffic is would be turning, and where we are trying to put in pedestrian lanes. So the next thing we did was a cost benefit analysis. So again, working with our Department of Transportation within Cherokee Nation and Cherokee Nation Public Health's epidemiology team, we were able to develop this cost estimate on what it would take to put in new sidewalks, new streetlights, crosswalks, and do some beautification. We were very lucky that we had a community center that already had a walking path. And so we were connecting this path to the community center's walking path to get them off of the road. So they had very limited time on that main road. So you can see here that we know the areas in the black were our cost estimates, that we did get those, and the areas in the gray are what we kind of approximate what those costs would be. And it goes from what is the lowest cost to the highest impact. And so we wanted to make sure that we did cover those high impact elements. These were the recommendations based on the development from our analysis. And so some of those were to work to develop the speed control measures, such as lowering the speed limits and adding signage, because there was very few signage in this area as well. And again, that main speed limit was 35 miles an hour. And so recommended to take that down to 25 miles per hour. Consideration to expand the project beyond the school and the community center. So our main focus right now would be for the school and the community center, but we do have a small store that is just down the road that we do see a lot of pedestrians and bike riders using this main road. And then school-age children, pedestrian safety education. So going into the school system and teaching them about pedestrian education, community engagement. So a lot more talking to the community, finding out what their needs are, and again, meeting them where they are. And then cost considerations, looking at higher impact elements. So we definitely wanted to look at those high impact elements on that cost benefit analysis chart. So these are some before pictures. The top left will be the school, and you're going to see the middle on the top would be the community center where we would be putting a gate. You can see some of the traffic. We do have a lot of construction type vehicles traveling through this area. And then the bottom two pictures on the left-hand side are going to be just some pictures of the school and the roadway that we were looking at. And then this area is completely dark at night, and that's represented in that bottom right-hand picture, and that is from our community center. So there is no visibility at night on this road. So one of the very first things that we did is we did pedestrian education with our 5th and 6th grade class at Kenwood. And Ian and I went in and we talked to them about how they would cross the street, what to look for, what to listen for, making sure they made eye contact with drivers, which I did find out that a lot of the students said that they didn't even realize that they needed to make eye contact with the drivers. As long as they stopped, they felt safe to cross the street. So we did make sure to really hit home on that, as far as that they were actually looking at the driver and they were making that contact so they knew it was safe to cross. And then we did a lot of exercises on responses. What did they notice about walking to the community center? What were the issues? So we really wanted to dig deep to find out what that perspective was from students. And then we went into our quick build project. And so we did planters and delineator posts, and we had these pedestrian signage, and the kids got to come out and help us. We unfortunately had some rainy weather that day, so we didn't get to paint crosswalks, but the kids did get to come out and help and plant flowers and set up delineator posts. And here's some more pictures. Later on, I believe it was a couple weeks later, we did get out there and we got to paint these crosswalks. And then this is a short video, but I'm going to go ahead and skip this just in case sometimes we do have some technical difficulties, but this is kind of the area where we did our quick build. Oh, it is going to play. All right. So then after we finished the quick build, we did do some evaluation and feedback questions with the students and with the community. We had QR codes set up at our community center for anybody that walked that path. And as you can see here, our walkability score in Kenwood before was at 10.5, and then after was at a 24.7. So when you do that questionnaire, it does give you numbers that you add up, and it's going to tell you exactly what kind of community you have. So it went from it needs a lot of work to it's a disaster for walking. And then it moved to celebrate a little, your neighborhood is pretty good. So we made some improvements. Some of our key takeaways, we did notice a lot more dogs on that second set of surveys. 67% of the responders in the pre-survey noted the path was poorly lit, and 32% in the post-survey. The percentage of respondents also noted lack of sidewalks dropped from 100% in the pre-survey to 21% in the post-survey. Some of our limitations, though, were a small sample size, the timing that we did the project, and the time of day as well. And here's our kids when they were doing feedback. So from this, we wanted to make sure that we did a nice report that we could present to our tribal council and submit for funding for a permanent infrastructure project. And with that, we did utilize our data to tell our story. We took, obviously you can see we've taken a lot of pictures of the project with feedback and mapping, may change the actual route. So we did discover there were some issues with our route. And so I know that we had to go back and look at that. We worked with our Department of Transportation to come up with the best route and what works for the students in the school and the community. And so as of July, we were able to receive funding and we started permanent infrastructure. So this is kind of the mapping out process of that. And here are some of those finished sidewalks and new crosswalks that went in. And then on that picture at the left, you can kind of see where we had to make some changes to our initial project. And I just want to say Wando and thank you. And I'll be turning the next quick build project presentation over to Sherry Bozick with the Pueblo of Jemez. Thank you.
Hello, thank you so much, Hillary. Hi, everyone. Thank you for joining our webinar. My name is Sherry Bozick. I'm the Director of Planning, Development, and Transportation at the Pueblo of Jemez in New Mexico. The Pueblo of Jemez is a federally recognized tribe in north central New Mexico. It is home to over 3,900 tribal members, renowned for its cultural richness. The Pueblo is the last community of native Toa language speakers. Pedestrian pathways are vital to the Pueblo as many community members rely on walking, running, and biking for daily activities, cultural events, and recreational purposes. One of the Pueblo's greatest safety challenges is to provide safe pedestrian facilities along the New Mexico 4 highway. This map shows where the New Mexico 4 highway bisects the Pueblo of Jemez village between mileposts 2 and 8. The image to the right shows the posted speeds, which change 4 times within the 6-mile section through the Pueblo. The Pueblo's children are picked up and dropped off at the numerous locations along the NM4, and residents and visitors frequently cross the New Mexico 4 to access homes and services. The Pueblo's goal is to work with the New Mexico DOT to mitigate pedestrian safety issues along this highway. We will continue to identify and implement safety projects such as the new 2-mile pedestrian trail that we have installed in the main village area to protect those who live and work at the Pueblo and those who visit. A large part of our project at the Pueblo did involve installing pedestrian safety quick build measures, but we were not able to successfully implement those, so we turned our project to a tribal road. And I just want to point out many tribes throughout the US do face the issue of having state highways bisecting their land in highly populated areas. And so we're all discovering that it's going to take a lot more work to work with the states to implement quick build projects due to liability issues with these state right-of-ways. The Pueblo is also, we also completed a quick build on, oh, excuse me. We're also working to improve pedestrian safety on tribal roads. So because we couldn't do the quick build on the highway, we're doing these on tribal roads because we don't have to do high costly studies or feasibility studies that the state requires. So we've successfully implemented quick builds on tribal roads and had really wonderful and positive feedback. This slide shows photos of a quick build that we did at Jemez Day School on Day School Road. We involved all of the children that go to the school. We installed dedicated sidewalks and some chicanes to slow down traffic. This roadway was super wide. And so we had wonderful feedback from the school, from the students, the teachers, and community members. We have also recently installed solar-powered speed feedback signs on this roadway to remind everyone that the speed limit is 10 miles per hour, and it's reducing the speeding issues that we've been seeing in this particular area in front of the school. The Pueblo also completed a quick build project on Sheep Spring Circle with the help of our dedicated team that you're hearing from today, Cherokee Nation, Confederated, Salish, and Kootenai tribes, University of Montana, and America Walks, and our amazing Pueblo of Jemez staff and leadership. Our team is grateful to have received a Road to Zero grant to fund this project, the workshops and the webinars that we've been carrying out throughout the life of the project. This image shows where we installed pedestrian facilities and crosswalks to calm traffic in this residential neighborhood. So how much does a quick build project cost? This table shows the cost for supplies and materials for the Sheep Springs quick build project. Of course, the cost of the quick build varies depending on size and scope, but the Pueblo has spent between $10,000 and $13,500 on our 2 quick build projects that we've recently finished. These are photos of our staff and volunteers in action at the Sheep Springs Circle Quick Build Project. I'm grateful to have worked with my staff, my colleagues, tribal leadership, volunteers, and our awesome RTZ team to plan, design, and implement our Quick Build project. Everyone's super dedicated. I just feel so grateful to have leaders, community leaders who care deeply about pedestrian tribal safety, and all of our team from around the country. To wrap up, here are some of the results of our community survey for the Sheep Springs Circle Quick Build project. A majority of Pueblo community members support the project and the development of permanent improvements along this residential roadway. So we're excited to look into opportunities for funding and to install something permanent in this area. And that's really the mission of quick build projects is to set them up, get community feedback, see how it works out for improving safety, and then implementing something more permanent in these areas. So that's all I have for now. I'll be available for questions during the Q&A session. Thank you so much for joining us today. And I'm going to hand it over to Sam and Maya to talk about their portion of the project.
Thanks, Sherry. Can everyone see my screen? Yes, okay, thanks, Ian. Hello, everyone. My name is Maya Pedersen, and I'm an assistant professor at the School of Public and Community Health Sciences at the University of Montana. And I'm going to pass it over to my colleague for the first part of our presentation.
Hey everybody, my name is Samantha Morjo. I'm a doctor of physical therapy with the Confederated, Salish, and Kootenai Tribes Tribal Health. I'm also an enrolled Bitterroot Salish tribal member for our CSKT. So I am primarily a clinician, but have dived into the research world, and so I'll get us started. I think, Maya, if you want to go to the next slide. So here you can see our team. On the right side of the screen is our community advisory panel. And then on the left side of the screen, the top part of it is the CSKT employees and CSKT community members who are part of our team. And then on the bottom there is our University of Montana School of Public Health team members. We are, overall, our team is called Growing Older, Staying Strong. We conduct CBPR research on the Flathead Reservation. And our Growing Older, Staying Strong team is, like I said, it's a collaboration between Tribal Health and the University of Montana. We were founded in 2018 through an MOU between CSKT and the University of Montana. So I always feel a little bit uncomfortable talking about this just because I did create the logo that you see there in the middle. I am not a professional artist or graphic designer by any means, but I did make it to reflect our values, our history, and our future with this team. And so I just share a little bit about the meaning of each of the components of that logo when we share our work. And so the trees represent our healthy communities. The roots represent the strong foundation of that our ancestors provided for us. The bison are a visual representation of the resilience of our people. If you know the history of Native Americans, you know that the US government tried to exterminate or eradicate bison and as a way to starve out Native Americans. But not only are Native Americans still here, the bison were not extinct. And so they're also especially meaningful to CSKT because we were recently able to reclaim the National Bison Range on our reservation, and so CSKT actually owns that national park now. And so then the mountains symbolize our homelands, the longevity of our people, and our connection to nature. And then the circle around the outside is actually a nod to my late dad, who used to end prayers with "Keep everyone in the middle," as a way of saying we protect and care for our loved ones. So we can go to the next slide, and I'm going to pass it over to Maya for this next part.
Thank you so much, Sam. So building from Sam's mention of our community-based participatory research partnership, we have this overall focus that's on well-being for older adults. And we started a lot of our work in this kind of physical activity space, so health promotion, but we have moved into thinking more broadly about movement and health promotion on land among older adults. And as we have continued through our project, we've just learned that transportation and outdoor spaces and safety are really important to this type of work. And so not only do we continue the work around physical activity and health behavior promotion, but we also are now in a space of environmental change and really thinking about pedestrian safety as a way to do that. So we use these 8 domains of livability as a guide. We also use another intersections of transportation and health as a guide to really orient and convey an understanding how transportation and health are related. And we think a lot about the neighborhood and built environment, how that is impacting community members' ability to engage in healthy behaviors, as well as the social and community context, their feelings of safety and acceptance and place, and how that interfaces with the world of transportation and pedestrian safety specifically. So our project is called Our Voice in Motion. And spoiler alert, I have this flyer for the quick build that our project ended with up here just to show you what we did yesterday. We just barely got all of our pictures on our slides because we just finished our quick build yesterday, but I'll be kind of telling you this, or Sam and I will be telling you the story from start to finish here. So we called it Our Voice in Motion, and we really leveraged some of the additional opportunities that are going on in the Growing Older Staying Strong project. For example, a falls prevention grant that we have, as well as a fellowship that Dr. Morrishow has, to really combine leveraging older adult lived experiences into a pedestrian safety project. We use the Our Voice method to guide our work for this focus on community engagement and really guiding us from start to finish with the needs and priorities of older adults living on the Flathead Reservation. The Our Voice method is out of Stanford University. There are multiple citations by Dr. Abby King, who kind of started this method, but there are so many iterations of the way to do Our Voice. And so here we put forth our iteration of how we conducted an Our Voice study, leading community engagement towards a quick build. So it has 7 steps, and the first step is engage. We started with engagement through the work that we already had ongoing through the Growing Older Staying Strong project. We recruited through our community sites where there are tribal fitness centers, and also co-located with tribal health centers across the reservation, mostly along, as you can see, this Highway 93 down here. These communities are primarily located along Highway 93. So we had ongoing falls prevention classes, and we recruited a sample of older adults from these fall prevention classes. So these are older adults living on the Flathead Reservation among these communities. So that's how we started with engaging the community. And the second step is called Discover. And this was an opportunity for community members who were recruited to walk around in their own communities and document their experiences as a person moving around and their feelings of safety and their feelings about mobility and fall risk. So we used the Stanford Discovery Tool mobile app, and we asked participants to download this app onto their phone and to use it to document throughout a week responses to these 2 questions. 1, what makes it easier or safer to move around in your daily life? What makes it harder or less safe? And then the following week, so that was for 1 week, the following week, what makes it easier for you and older adults and elders to move around, walking, biking, or in a wheelchair from place to place in your community? What makes it harder? And we asked both these questions because we wanted to know specifically about pedestrian safety, but we also wanted to know about mobility and leave this kind of open space for these responses. You'll also notice that we asked both what makes things harder and what makes things easier, because we want to know about the strengths and the resources that are already being used in the community. Within this app, there was also an opportunity to tag a piece of data. For example, take a photo, provide a voice memo or a text note alongside that photo, and then tag it with a theme that they're thinking about. And the tags that we put forth for the study were street design, walkability, community connectedness, fall risk, and we're in Montana, so weather. So the results from step 2, Discover, we were able to collect quite a bit of data between October and December of 2024, so last fall, surprisingly, as the weather was changing. Unfortunately, we only had responses in terms of place from 3 communities, but we had quite a bit of responses in those communities. We had 28 walks, there were 64 photos and 65 narratives that were put forth. And then we had 70 tags, and of note, 50% of those tags mentioned walkability, and much fewer mentioned fall risk and others. And so we're mulling that over and what people, how people responded and how they tagged their photos. Here are a couple of examples of the data when they come out of that Our Voice app. They're uploaded into a portal that Stanford manages that we then have direct access to, so we can get the photos, we can have access to the voice memos that were recorded in the app. The photos are geotagged so we can see where they took place. And there's also, you see this little green smiley face, sometimes there's a frowny face. They can assign whether it's good, bad for the community, or both. And so this is an example of what those data look like. And here's one, the quote was, "Need more safe crosswalks like this." So this was a good example of a crosswalk from a participant. And this was up in Polson, Montana. Here are a couple of others, examples of data points. These were both in the location where we ended up doing one of our quick builds. It's a walking path called Elders Park behind the tribal health center in St. Ignatius, Montana. And there were a few comments, one about lighting and another about the downhill and steep grade moving from the parking lot into the walking path. And so we collected all of this information together to move into steps 3 and 4, where we took all of the data points. You can see on these pictures, there are these posters that have the photos, the maps, the quotes that are associated with the photos. And we printed them in large format on these posters like you would at a science fair maybe. And we put them up, we brought them to 5 communities and we put them up and we asked our older adult participants who are in the falls prevention program to add comments to these. So one really important crux of the Our Voice method is that it's not designed to collect individual level data and use that as the unit of analysis. It's designed to collect information from a community and then to be brought around for additional collective conversation around thematic issues that might be arising in a community. So it's really important for us to bring these posters around and have additional comments be made, to use the photos as an opportunity to spark conversation, and to both have them be conversations around what issues or resources are existing, as well as what might be able to be done to address those issues. And so these were steps 3 and 4 of the Our Voice method, discussing and then imagining what could be next. Results from this that we ended up having 39 participants across those community conversations. And I'll just tell you quickly, you can kind of see up here that the average age was 68. We did have one 29-year-old who popped in there, but we also had an 82-year-old. So we had quite a span of ages. And we had quite a few participants who were Native American. It was almost 75% of the participants were American Indian or Alaska Native in their demographic survey. We also presented these to our community advisory panel in February. So this is kind of moving into the next phase. And then in step 5, where we activated, so this is where we're sharing this information with additional stakeholders and potential policymakers, as well as continuing to have community members involved. So from May to July, oops, I wrote 2026 there. I guess I'm a year ahead. In 2025, we had these community forums and meetings. We included a state senator, Senator Jacinda Morajo, who's from State District 46, which is where some of these communities are. The Montana Department of Transportation, the CSKT Roads Program, the Tribal Council. And I put how we had these meetings because some of them were in person at the Salish and Kootenai College, which is the tribal college. Some of them were in the tribal chambers where we brought these posters and set them up and actually left them for a week in the tribal chambers so that council members could be observing and kind of discussing these beyond just a presentation by us. And many of them were by Zoom and phone and however else we could get a hold of people. So that leads us into step 6, which is change. And I'll pass it back over to Sam.
Thanks, Maya. Yeah, so as Maya mentioned, that leads us to step 6. And step 6 is where planning meets action. We're moving from the data discussion and talks with the stakeholders and community members to going into real world improvements to make a visible difference in our communities. And so, like we said, we call it Our Voice in Motion. We started with the St. Ignatius quick build yesterday. And within the community of St. Ignatius, we actually chose 2 sites for quick build projects based on community feedback, those pictures that Maya showed with that path behind the tribal health clinic. And then also another site that we had identified close to our culture committee's main meeting, their central hub. And so it's also next to one of our early childhood center Head Start buildings. You can go ahead and go to the next one. And so you can see on there, those 2 yellow squares represent where we did those, fairly close. Our small communities. It was a walkable distance. Some walked, some drove. Bears and stray dogs were a slight concern, but everybody made it from place to place safely. So you can see on the top part of that picture is where the crosswalk behind tribal health was. And then down that lower square is the intersection that's by the Longhouse and the Head Start building. And so here's that crosswalk behind tribal health. The park that connects the tribal health, or the crosswalk connects the tribal health building to an area called Elders Park. And so we just called it the Elder Park Crosswalk. It had a previously existing crosswalk. It just was very faded. You can see in one of the pictures there, the asphalt is actually, or the chip seal is pretty broken down. Later, I learned that there's actually commercially available asphalt repair packages that we can purchase. And so one of our council members who attended yesterday suggested that we look into that, and that they were going to help us kind of pursue fixing that hole in the road so it was even less of a fall hazard. The paint really highlighted that the roads are very imperfect in that area. But you can see we had a pretty good turnout. People, were really excited to come help touch up the crosswalks. We did some artwork in it. Senator Morjo was our artist. She had participated in a traffic circle design project in Missoula, and so she actually happens to be my older sister. And when we started this project, I reached out to her and asked if she could, share her resources as far as paint style and things like that, or paint type. And she volunteered or offered to be our artist. And so you can see she's there in the middle touching up one of the images, and but she sketched everything out, and then community members were able to paint those flowers on there. Each flower that she chose has cultural significance to our tribal communities. So we can go. And then there was a cat who happens to just hang out at Tribal Health. He was our supervisor for the day. So you can see on the left there was the before picture, and on the right is the after picture. And so we also had our wildland rec crew from our natural resources department. They were able to come down with a skid steer and some, I think it's called pit run. It's a 3/4 inch gravel with some compacting base into it. And so they really, they called it scratching up the top couple inches of the path there. And then they put down the gravel, they smoothed it out, they made it wider. And then you can see the planters that we put out, and then the crosswalk post, or the delineator post, to just really increase the visibility of there. There's a fair bit of traffic that goes through there, even though it's behind the clinic. It connects one of the main roads there to an administrative building that a lot of employees use. So we were really happy to be able to do that. And so far, a lot of tribal health employees have reached out saying they love it. So the next intersection that we did was Saha Lane and Blind Barnaby Street. And this one was the one that is over closest to the Longhouse and that Head Start building. This was a 4-direction intersection, and it had no crosswalks before we started working on it. And so then we use this one as another way to show different types of quick build installments. And so Ian actually did design the bulb outs for us, and then Jacinda selected colors from our seasonal round, which is an education tool developed by one of our Salish elders, and then approved by our Salish Kalispel Culture Committee. And so the colors represent each season, and so we use those in the corresponding directions. And then the plan is, now that the paint is dry, Jacinda will go back and add in the Salish word for each season that the color represents. And here we were actually able to get one of our IT guys down there late yesterday evening, and he did an aerial shot for us. You can see just the overall improvement. I did not have an aerial shot of the intersection previously, but none of that existed before. And so Maya and I actually were hanging out at the crosswalk yesterday evening, waiting for IT to come do it, do the aerial shot. And we observed the difference in traffic patterns just from before we had any improvement to that intersection to afterwards. Previously, I mean, I wish I had a radar gun for when we were there the day before. And people were driving through, you know, at fairly high rates of speed, definitely more than you would expect in a residential area. And then nearly every car came to a complete stop, if not nearly a stop, when they approached the intersection. So it definitely slowed traffic down. And a couple of kids were stopping to take pictures. So we're hoping the community likes that. And so now here we are at step 7, which is share. And we are collecting community response feedback. I'm going to pass it back to Maya because my 4-month-old is awake.
Thanks, Sam. Yep, so we're here at Share. We're starting today since we just finished it last night. We're sharing with you, so that's super exciting. And then what we really hope to do is continue engaging based on some of those other themes that came up during the original data collection, and continuing to do these types of projects based on community feedback. So thank you so much. Here's our contact information, and just really give a shout out to the collaborators that we worked with on this project and America Walks, as well as the funders, because this is a really special project to have worked on, and really thankful for it.
Thank you so much, Maya and Sam. And if you two could keep your cameras on, and Sherry and Hillary, if you'd like to switch yours on, and we have a few minutes for a little discussion. I'd love to just do a quick round. What was your biggest takeaway from the Quick Build projects? Sherry, maybe I'll start with you.
Thank you. Gosh, to identify one takeaway is kind of hard. So I guess having a state highway that goes through the tribal land is a challenge. We had proposed 2 different projects that were both kind of shut down because feasibility studies and things that weren't in our funding were required to do that. And it made me realize that we have a lot of work to do. The tribes have a lot of work to do to address highways, high-speed highways going through tribal land. So for now, we're going to do these quick build projects on tribal roads, but I think tribes need to get together and identify ways to work with their states to really implement the projects that we want to in the biggest problem areas.
Great, thanks. Hillary, your biggest takeaway.
Sure. I'm like Sherry, and it's really hard to pick just one big takeaway. But I would say that my biggest takeaway, and I've noticed it in every single community that we were in, is there's a lot of community collaboration. You can tell that each one of us has worked really hard in our communities to talk with our community partners, whether that's through a school, whether it's through, I worked primarily with the county commissioner and our Department of Transportation there at Cherokee Nation. With youth and elders and just community partners. And so that's my biggest takeaway, is just getting to see that community collaboration.
Thank you. Samantha?
I'm going to kind of echo Sherry there. Just getting that, figuring out the way for tribes and even just local communities to work with state, and I'll even go up higher and say the federal DOT and their regulations. We also had a plan A and then a plan A .2. I'm not sure how to a second version of plan A, and neither of those worked out because of permitting restrictions. And so thankfully we were able to shift really quickly, and tribal and local community leaders were very supportive, and we had a lot of community buy-in, but getting to the state DOT and even federal to work better will be phenomenal. It's where we need to focus.
Yeah, and I responded to a question in the Q&A about the challenges with working with state DOTs, but we're hoping to overcome those in the future. Maya, your biggest takeaway?
Yeah, I think my biggest takeaway was just the appreciation that I have for the support that the CSKT Tribal Council expressed as we were presenting to them. Sam and I came with this really well thought out presentation. We're like ready to defend this project, and they were like, great, what other communities will you do them in, and like how soon will you be doing those? And so I just was really excited. I think I was surprised and really excited to hear that there is this support for these types of projects, and just really heartened. And so that's mine.
Yeah, definitely. And staying with Maya and Sam, your project can be described as a community-based participatory research and intervention type project. What do you see as the benefits of approaching a traffic calming issue in that way?
I can start with the response. We're really looking at this from a public health lens, and so Dr. Morso is a clinician, and so she's constantly being asked, like, how does this relate to health? How does this relate to our health department? And so we're really trying to blend these two concepts and make clear that transportation is not separate from health, and pedestrian safety is not separate from health. And so having these forms of data, and others in the call today, Hillary and Cher are also collecting all types of data and information, really making these data-driven decisions provides a certain amount of legitimacy to different types of stakeholders that we might be in conversation with. And it also allows us to share the outcomes in a way that might ring true to others who might not otherwise be paying attention. If we're putting it into health outcomes, if we're putting it into safety for grandparents or grandchildren. And so we're trying to tell stories to a variety of audiences at once, and sometimes those data-driven choices really are supported by this type of practice.
Sam, you want to add anything to that?
I think Maya covered it really well. Tribal leadership was really supportive, but the only after I kind of explained the connection of like why am I getting tribal health involved in this? Specifically as a PT, and so building that connection for them. Just because it was like intuitive to me. The health world doesn't necessarily see like why are we drawing that connection or connecting to transportation. And so actually there's a question in the Q&A about working with tribal leadership and moving forward with walkability efforts. Our council members have actually asked our PT department to be more involved as they're building out skate parks and playgrounds, and including installing walking paths in other communities. They want us to take a look at it and make sure that these areas that they're trying to make, for more community activities, that they are, more friendly to people with mobility challenges, reduced fall risk, just making our communities more walkable. So that's been a phenomenal outcome of this.
Great. Now, one of the outputs of this Road to Zero grant has been a tribal pedestrian safety resource library. Hillary, you've been leading that effort. Can you just take about half a minute to a minute to give an overview of what people can expect?
Sure. So within the resource library, we wanted to give a lot of things that each of you might be wanting to use within your community, and showing some of the data tools that we have used in these projects. And so pieces that you're going to be able to find is an infographic that you can share with community members or partners that will display some of our challenges that we've seen on tribal pedestrian safety, as well as some countermeasures. We have some data collection tools such as speed radars, stop sign compliance, and walkability assessments. You'll also see video links to our two projects in Pueblo of Jemez and Cherokee Nation. We did two videos on those to show kind of how that project took place. And then you'll also be able to find reports and toolkits, which include the Kenwood Walkability Report, and then several of these webinar reports from our roundtable assessment. And I think that should conclude everything that would be covered in those.
Yeah, and we'll be publishing this within a couple of weeks and send that out to everybody who attended this webinar. So final question then. We're hoping that people in the audience who haven't done a quick build project before will do so over the coming months or years. One piece of advice for people doing this. Sherry, why don't you go first?
I would say try to get other departments and programs involved collaboratively really early on in the project, just so everyone can weigh in, and of course your community members. So gather your team early, really talk about the location that you want to work with, get approval from your tribal leadership really early as well. If you're trying to do one of these on a state road, we got them engaged really early and that didn't work out well for us. So I'm not sure what to say about that. But if you're doing it on a tribal road, definitely get your whole team together early and get their help and input right away.
We're going to crack the nut of state DOT roads. Sam, your one piece of advice.
I would probably just echo Sherry again, just making sure that you're getting your community and your local leaders on board, early in your process. Another question in there about like people with mobility challenges, and we did make sure we were taking that into account. And so definitely making sure you have a comprehensive viewpoint just from your different community members. And then with that walk audit that we did, that helped a lot.
Thank you. Hillary?
So I would say have a backup plan, just in case plan A doesn't work out, always have a backup plan.
Great. Okay, well, I'm going to wrap things up. We're at time. I do want to let everybody know that we have developed over the course of the last 15 months or even longer than that, a national network of tribal pedestrian safety advocates and professionals, some working in tribes, some residents of tribal communities, other professionals and advocates who have an interest in this issue. Everybody who attended this webinar will be invited to join that network in a follow-up communication. This is something we're going to keep moving forward with, and having a large national network will help us achieve some of the changes that we're hoping to see, including figuring out the permitting process with state DOTs. I do want to just share my screen for the last couple of slides again and give you another opportunity. Oh, excuse me. I have to hit that first and then share my screen. There we go. Give you another opportunity to support our work at America Walks with this QR code and the link in our chat. And finally, let you know that America Walks next webinar will be in September. We haven't finalized the date yet, but it will focus on the National Week Without Driving, which is the first week of October, which is your opportunity not just to go a week without driving or even a day or two without driving, but to advocate to your public officials that they should do this so that they can learn from direct experience what that is like if you are relying on walking, biking, rolling, or public transport to accomplish all of your activities of daily living. This is a campaign that we have been implementing for a few years now, and it is leading to a better understanding by people in power of the challenges of moving around a community without a car, and new policy that will lead to more walkable and accessible communities. So with that, thank you very much to Julia, to our panel, to my colleague Madeline, and we'll look forward to seeing you at the next webinar.